cricothyrotomy with catheter over needle. An advanced care paramedic may perform a needle cricothyrotomy when the following indications are present. There is a need for advanced airway management, and intubation or supraglottic airway insertion is unsuccessful, and you are unable to ventilate the patient. Prior to proceeding with this procedure, you are required to patch for online medical direction. Examples include patients with anatomical airway obstructions consistent with a tumor growth or inflammation from caustic or heat sources, signs of a fractured larynx, and pediatric patients. This is a short-term yet critical intervention that can restore a patient's ability to move oxygen into the lungs. Like all treatment skills, prepare all of your equipment in advance. This includes a biohazardous sharps container, appropriate personal protective equipment, bag valve mask and filter, a 3.0 or 3.5 millimeter ETT, a 3 cc syringe, a 14 gauge 1.75 inch needle over catheter, alcohol swabs, and tape. A cardiac monitor with end-tidal CO2 capabilities and a stethoscope is also required for placement confirmation and ongoing monitoring. Ensure that all monitoring equipment is in place on the patient. Attach the airway filter to the inferior aspect of the end-tidal CO2 adapter, and BVM will connect to the other side of the end-tidal CO2 adapter. Open and ready the alcohol swab, the catheter, and the 3 cc syringe. Attach the syringe to the catheter. Open the ETT and remove its 15 millimeter adapter and reserve it for later to attach to the IV catheter. Lastly, prepare the tape that will be used to secure the catheter in place. Landmark for the cricothyroid membrane insertion site. This membrane is located between the inferior margin of the thyroid cartilage and the superior margin of the cricoid cartilage. Cleanse the area with an alcohol swab using an inward-outward circular motion. Maintain visual contact with the insertion site and prepare to advance with the catheter and syringe using a 45-degree caudal approach. Once you feel the membrane has been penetrated, aspirate for free air using the 3 cc syringe. If the plunger releases freely, the tip of the needle is in the trachea. Advance the catheter off the needle and into the trachea while holding the needle and syringe steady without advancing or retracting. Once the hub of the catheter is seated against the skin, withdraw the needle and syringe and dispose safely. Attach the 15 millimeter adapter that was removed from the ET tube and attach to the hub of the catheter. Attach the BVM to the ET adapter and evaluate for placement. This includes end-tidal CO2 numeric reading with a 4-point waveform, equal air entry in all lung fields on auscultation, and visible chest rise when ventilated. Once placement is confirmed, secure the catheter in place. Ventilating through a 14-gauge needle will require constant attention, as there will be noticeable increase in airway resistance due to the size of the catheter, and the chest relaxation and passive exhalation of the patient will take longer.